stuff. He's, I think, almost a 4.0 GPA. 4.0 GPA, the audience knows. 4.0 GPA. I like Brad because he's very dynamic. He can go to the super book world and then go in communication world and do really well at both. And the guy's been practicing and adjusting like it's his day job. He's a hard worker. I'm curious to hear what he has to say about functional neurology. He's been working on this piece for a long, long time. So without further ado, let's kick this thing off.
Hey guys, thanks for coming out today. Gotta stay hydrated. Like Paul said, my name is Brad Bodle. I'm a 5th quarter student, and my talk today is a functional approach to chiropractic. Before I get started, I'd like to thank Paul for coming out, inviting me out here to speak to you guys, doing something a little bit different. He was looking for a talk with a little bit more content, and hopefully I can deliver that for you guys today. It might run a little bit over time, like he said. I'll try to keep it quick, but if I'm going a little too fast, sorry about that. If I run out of air, someone drag me off to the side. So for my talk today, I'd like to answer 3 big questions. And I think it's something that we all experience as chiropractic students. And the first one is, why can all chiropractic adjustments work for certain people at certain times? Now, superficially, we know this to be true because out in the field, you have all different types of practices. Nuka, Gonstead, Diversified, whatever it might be. All these people are doing different things, but they're all getting great results. So I want to look a little bit closer to that and see why that is. The second question is, why don't adjustments work all the time? Now, you hear about those patients who say, chiropractic just didn't work for me. And you even have doctors who are referring a patient from one to another, hoping that they might get better results with the other patient. So why is there that disconnect between people who are getting fantastic results and these other people who aren't seeing much of a change? And so, because you have these two different worlds for these people, how can we test and retest to know what's appropriate so we can give that patient what they need most to get well? So before we start today, I'd like to sort of get us all on an even footing and go over some basic neurophysiology. So what does a neuron need to survive, thrive, and grow? It needs glucose, it needs oxygen, and it needs activation. Now we're going to focus a little bit on activation today because as chiropractors, that's what we have the most direct effect on. So if this cell right here, this is a neuron, is getting glucose, is getting oxygen, how does the activation part work? Well, other neurons that feed into this neuron are going to release neurotransmitter. That's going to bind to this neuron, activating certain receptors which are involved with action potentials, such as our AMPA receptor. This allows sodium into the cell and could potentially have an action potential down the line. Now the really cool part is the NMDA receptor. Now, NMDA receptors are involved with genetic expression, but they're only activated electrically if the AMPA receptor is activated. So you need some sort of stimulus to activate the NMDA receptor. Once this occurs, calcium flows into the cell, activates a number of secondary messengers, which cascade towards the nucleus, allowing for genetic expression and the creation of protein. Well, what is this protein used for? It's used for enzymes, it's used for organelles, it's used for cell structure. All of these things allow for more ATP to be generated, more connections to be made, and it allows for better integrity of the cell and better health of that neuron. Now, why do I tell you guys this? Well, partially to reinforce something that you already know. You already know the adjustment has a great impact on one's health. So this is sort of the scientific backing to why it is. The other reason why is because I think it's a key link to all these different perspectives we have on chiropractic. We're all doing things a little bit differently, but in the end, it's all about neuronal firing and improving the health of that neuron. So this leads us into our first question, which is, why can all adjustment work? So something I see a lot of in school is confusion, and I've definitely experienced it myself. We have these different speakers coming in, promoting their techniques, and I don't blame them. That's what they love to do. They want other people to do the same thing. But it gets confusing when they're all about their technique, and suddenly at the end of their talk, they say things like, well, it doesn't matter which technique you pick. All of them work. You just have to find out which is best for you. Well, as the intuitive student, I think a lot of us suddenly have a lot more questions after that. Things like, should I really be picking a technique that's best for me, or can I pick one that's best for my patients? Is there a particular technique that gets more people well than another one? And if I can find that technique, how can I know that it's right for that person on that particular day? Now, this is further compounded when we get into technique classes, analysis classes. We're doing things all these different ways, different setups, different lines of drive, different contacts. And so things that are supposed to be similar are suddenly in direct conflict with each other. To understand how they're actually similar and how all these different approaches are getting great results, we have to again go back to kind of our neurophysiology and the pathways that the adjustment activates. So when you lay your hands on someone, what's really happening? Well, immediately you're activating tactile receptors, which are your dorsal column pathways. If that area is painful, you might be activating pain and temperature pathways, which is, of course, your anterior lateral system. Something that's really important is the changing of the muscle spindles, the joint movement. That's going to be unconscious proprioception and fuel directly into spinocerebellar pathways and feed your cerebellum. Also, you might have localized sympathetic response due to the need for fuel to come into that area. You know, the doctor might be a little bit smelly that day. He might have not washed up that morning. Suddenly you're getting emotional. You're getting a limbic. Who's this guy testing me? He stinks. This is the worst. But my point is that there's a lot of things going on. And I think we need to understand that this is really the essence of chiropractic. It's activation of the system, activation of specific receptors, which feed different neuronal pathways and go directly into the brain. Once in the brain, you activate different areas, allowing them to generate more ATP, more connections, and have an overall more healthy and integrated system. So this leads us to our next question, which is, if we have this great thing that can help all these people, can activate their brains, activate their systems, why don't adjustments work all the time? Well, I think the first thing and the most probably simplistic answer is it might not be a chiropractic problem. Now, I listed off 3 things that are needed for neuronal health: glucose, oxygen, activation. Well, what if the problem has to do something with glucose delivery or oxygen delivery? Well, adjusting them might not get you the best results for that patient. Instead, you're going to have to look at things like lifestyle, maybe diet changes, to really get to the root cause of the problem. The next thing is your area of activation. Now, we all know that different areas of the brain can function at different levels. And when you're activating the brain, you need to maybe activate that area which is at a lower functioning rate. So the cool part about this is, and it really goes back to our analysis and understanding of the neurophysiology and anatomy of the brain and the nervous system. The cool thing about it is, once you do that, you can start to do things like, well, I understand that the midbrain, the mesencephalon, isn't functioning at a rate it should be. Well, how can I fix this? Well, I understand the system, so maybe I have my patient chew gum. This is going to activate proprioception from the temporalis masseter muscles, which is going to feed directly into the trigeminal mesencephalic nucleus in the mesencephalon. That's going to activate everything around in that area, bringing it up to the proper firing and help that patient immensely. So these are some of the really cool things that we can do when we understand the system. Next is the level of lesion. And we need to understand that dysfunction can occur at any level within the body, whether that be the receptor, the end organ, the peripheral nerve, the cord, working all the way up to the brain. So when you analyze the system and you're looking at someone, they have pain in their elbow, is the problem in their elbow? Well, as chiropractors, we know maybe, right? It could be somewhere else. It could be in the neck. It could be somewhere higher. Well, the same sort of thing goes with subluxations or fixations, maybe in the neck. You know, is that where the problem is? Is that where the cause is? Again, maybe, because that area is dictated by functioning of the brain. So you might have a depressed area of the brain, which is changing the way that vertebrae functions in space. You know, additionally, you could have something like that the brain intelligently placing that fixation into the spine to stabilize the spine, because there's dysfunction in the vestibular or ocular regions. You might have to treat that first, then be able to go back and fix the fixations within the spine. So finally, and I think this is probably most important, is your level of activation. And I always compare this to training to run a marathon. So when you decide to go train for a marathon, do you go out and run 26 miles the first day? Of course not. Well, the same thing goes for activation of the system, activation of the brain. You can't come in to a neurodegenerated patient and activate their system. Just like with the training, with the muscles, ligaments, all that's going to be sore, you're going to be exhausted for a week. Your brain might not be able to receive that sort of stimulation. So what can we do about that? We have to understand the system. We have to understand that maybe less is more in certain situations. At times in chiropractic, we've sort of described these negative effects of overstimulation as either retracing or adaptation, and we know that that's not necessarily true anymore. It's just we didn't analyze the system correctly and overloaded the system. So I've now painted two pictures for you guys, where one, we have this great utopian place where chiropractic adjustments are awesome, and that's true, they are, we know they are. But I've also described a place where we can cause neuronal damage or neuronal death due to overactivation of the system. So how do we know? How do we choose one and not the other? Well, the first thing is to understand what our testing means and understand the nuances of the test. When you lay your hands on someone, you feel things differently than anyone who doesn't have experience with touching a spine. The same thing goes for neurological testing, orthopedic testing, whatever it might be. If you're having someone do a finger-to-nose test, you need to know what that's testing for. You also need to know the nuances, just like the nuances of spine. If someone's doing finger-to-nose and they come in like this and touch the nose, or they come in like this and miss the nose, what does that mean? There's nuances to it. Well, the first one could be more of a cerebellum problem, and the other one might be more of a mapping problem. You don't know where your hand is in space. So these are the things we really need to understand. The next part is we need to test and retest. You need to have objective testing that goes on and a compilation of those tests. Once you do that, you can get a functional working diagnosis, which allows you to appropriately provide that patient with what they need. Once you apply your adjustment or whatever treatment it might be, go back and recheck those things. If they got better, great. If not, well, we know to go back and reanalyze what we were doing. Lastly, I think it's important to say that no single test is diagnostic. The system is complicated, it's dynamic. We work in different ways. One person is not the same as the other. So it's important that we have a whole list of tests that we do. That way we can figure out exactly what the patient needs and what's going on in their system. So what did we learn today? I think, and I hope you took away from it, that we work in one of the greatest professions in the world. We have a great window into people's health, and we have a great ability to make them better. Secondly, if we don't make them better, we have a huge tool belt and a huge variety of perspectives on things, which allows us to get those people better in maybe a different way. And lastly, if we test and retest and really understand the system, we can make our treatments for these people, our providing of the building blocks of life, if you will, for these people, even that more effective. Now, I want you all to remember that, nothing in this life is absolute. Nothing is black and white. Whether it be, chiropractic or someone's health. When a patient comes into you, they're not going to be A or B. They're going to be some shade of gray. As a doctor, you need to take the responsibility, understand the anatomy, understand the physiology, and be able to check that person's system, understand exactly what's going on, and provide it with what it needs. If we can do that, we will have the greatest patient-centered healthcare system in the world. We'll be able to change the way people think about their health, and we'll be able to change the world by changing the lives of individuals. Thank you.
Bradley photo. Bradley photo. I told you he has a 4.0 GPA. I wasn't lying. I wasn't lying.